Good morning once again from the office of Dr. Mackay, Vein and Circulation Specialist, where we are once again talking with Bethany, who is one of the physician assistants. And this morning we are talking again about spider veins, which is something that really both male and female have. Talk about what they are, what causes these things called spider veins, Bethany.
So lots of things, mostly genetics. They're little dilated veins that you see on the surface of the skin. Usually they're red or purplish in color. Like I said, most often genetics have some part to play, but also trauma can do it. Pregnancies can exacerbate them as well. So there's many different reasons for them.
Can you prevent them in any way? Is there anything we can be doing? Obviously you said genetics, but anything we can do to prevent them?
You can try wearing compression, but for the most part, no, you're going to develop them.
All right. Well, they are a little unsightly. I know a lot of people bothered by them, but the good news is there's something you can do to get rid of them, or at least most of them. So talk about the procedures that you guys are doing here in the office.
So most often we use Sclera Therapy, which is the gold standard treatment, which is an injectable agent, a sclerosant that's injected into the vein to shut it down. There are other options, but that's really the gold standard and what we use for the most part.
So when you say shut down this vein, is this, I mean, its legs are still functioning fine? I mean,
we're just talking about the cosmetic vessels, not any of your normal vessels. We're not trying to shut anything else down, just making your legs look better.
Okay. So how many procedures? Is it painful? How do you describe it?
So everybody averages about 3 to 5 treatments, but I have some who do 1 or 2. Sometimes people need more, so the number of treatments varies a bit. Discomfort, I've had it done myself. It's uncomfortable but not unbearable. You can stand 15 or 20 minutes of anything if it's worthwhile, and it is. So, you know, it is little needle pokes, so that's a bit uncomfortable. Most people tolerate it very well.
I know, they want to get rid of them.
Yes.
Is it in and out of office procedure? I mean, is this something, can you still drive home afterwards?
Yes, like I said, it takes about 15 or 20 minutes. You just basically get out, we say get out there and walk. That's the post-treatment. No heavy exercise for a couple of days, no sun for a couple of weeks, but otherwise go back to your regular activities.
Do you see them? I kind of mentioned the men and female aspect of this. Do females get them more than men? Is it kind of the same?
We tend to see more in females, but I have both male and female patients.
Would most people be a good candidate for the procedure that you're doing here that you talked about this morning?
Yes, and they can always come in for a free consultation. We can take a look and see what's going on.
All right. Well, thank you so much again for being here this morning. Thanks for allowing us to be here. And again, that free consultation they love to do here at Dr. Mackay's office. And they have a great website. We have a great website too where you can find all that information, tbmorningblend.com.